everyone, welcome to the Front Row with Ed. Today we're talking about knee pain and the importance of being able to work the muscles of the lower leg, because we can have what's known as little myofascial trigger points or tender points in the muscle that can be contributing to knee pain. Okay, so I would prefer that you roll out your legs with a foam roller. Okay, so I'll put a link right up here to the video on foam roller for the knees. But if you can't, for a variety of reasons, okay, I have patients who have had maybe knee replacement or hip replacement and they're still having a lot of muscle pain, or someone who's got a shoulder injury and they can't get down on the floor. So this is a 3-foot closet dowel, okay, easily available at any local hardware store. Okay, so once again, I'm going to show you how to do the quad. So I'm just going to use my right leg as an example. Okay, we want to break the leg up into 3. Basically a top part, an inside part, and a lateral part. Okay, now I'm not rolling like I'm, making chapatis or something like that. What I want you to think about doing is having a little bit of muscle in here to actually be squeezing out or kind of squeegeeing out the muscle. Okay, so you do have to put a little bit of pressure into here. You're going to push down, but you're also going to come back up again. Okay, we're looking at about 10 to 12 strokes. Okay, so I'm going to come up and down my leg through here. Now, any place that might be a little tender, I'm going to come back after my 10 strokes and I'm going to give it a little bit of work for about a minute. Okay, so that's the front. Typically the front will not be as tender. Okay, that's just the way it is, because when we do our basic quad stretching, we tend to stretch what's known as the rectus here, but we can't stretch the outside and the inside as well, so they tend to be a little bit more tender. Now what I'm going to do is I'm just going to roll my leg in just a little bit. Now what I'm doing is I'm kind of exposing this lateral part of my leg. I start all the way up through here where I hit that bone. That bone's called the ASIS. I'm putting a little muscle into it, and I'm coming all the way down until I hit the outside part of my kneecap. Okay? Once again, I'm going both ways. I'm going to change the angle just a little bit here, and I'm going to put a little bit of muscle into this. Okay? I want you to think about we're trying to push some fluids in and out of that muscle. Okay? Once again, 10 to 12 strokes where I might be a little tender. Usually there's a little tender spot right there. I come back and I give that a little bit of love for about a minute. Okay? The last one I'm going to do is the inside of my leg. Okay? Once again, I drop my knee out, put a little muscle into it here, and I'm working the inside. Now on the inside, where you're more than likely going to be tender, is right above the knee. Okay? The vastus medialis. Okay? That trigger point there gives us a lot of knee pain when activated. So 10 to 12 strokes. Okay? Come back to the spots that are special for about a minute or two. Okay? Be careful that you don't overdo it. Okay? Because you could take a trigger point and make it very painful. Okay? So we're doing 10 to 12 strokes. Anything that's tender, we're going back and giving it a little bit of attention for about a minute or two, and then we're done. Okay? So it should take me no more than about 5 minutes, okay, to roll out my quads on each side. If you're spending more than 5 minutes, that you're using a little too much time. Okay? Now, you can repeat that every day if you can. Okay? And the idea is that we want that tenderness to start to drop down. Okay? And it might take a couple weeks. Okay? But as you start to get a little less tender through there, you should start to notice a little less pain with functional activities, be it biking, walking, squatting, whatever it is that you're doing. Okay? So a lot of knee pain is caused by trigger points in the muscles of the thighs and the adductors that don't have to be there. I think we throw the flag up way too soon on certain things because we say, oh, it's just because of knee pain. So give it a try, see how you do. Leave me a comment down below if you have any questions. And remember, I prefer that you do it with the foam roller. And I have the link at the beginning of this video for that. But see how you do, and good luck. We'll talk to you soon.